Hi, my name is Phil Walls. I'm Chief Clinical Officer for MyMatrix. Thank you for joining us in our ongoing series of blogs concerning analgesics. Today we're going to talk about what I will describe as arguably the two most common non-narcotic analgesics, acetaminophen and aspirin. Now, I'm including aspirin not because it is used so much as an analgesic today, but just because of the historical significance. It was discovered about the same time as heroin and has been in use continually ever since. Today, though, rather than analgesia, we typically only see aspirin used as a blood thinner. However, related to aspirin is the category of drugs known as NSAIDs, or non-steroidal anti-inflammatory drugs, things that you're familiar with, such as ibuprofen and naproxen. So what's the difference between these type drugs and acetaminophen? Well, acetaminophen is an analgesic. In other words, it stops pain, although admittedly we don't know how it exerts that effect. And it's also a very strong antipyretic, meaning that it reduces fever. The NSAIDs, we understand a little bit better in that they relieve pain, not through a direct analgesic effect, but by relieving inflammation. So to a prescriber making a choice between these type drugs, that's a very important distinction. So if the injury is associated with inflammation, or if the patient has a condition such as rheumatoid arthritis that causes inflammation, then an NSAID is a very good choice. You will, however, also see acetaminophen used in these because it will relieve pain regardless of the cause. Other than that, what do we need to keep in mind? Well, in terms of side effects, we know that the NSAIDs irritate the stomach and cause problems, so this is why you'll see some type of stomach protectant, such as a drug like Zantac used in addition with it, or Pepcid, Prilosec, etc. They can also cause fluid retention. They cause cardiovascular complications in many patients. So like I said, they're not without their own concerns. Acetaminophen, on the other hand, has a very potent damaging effect on the liver. And this is probably the most important thing to keep in mind when it comes to dosing these drugs. With acetaminophen, we should never exceed about 3,000 milligrams per day. Now, you will hear instances where a physician will make a choice to exceed that amount, but only do that under direct physician supervision. When it comes to reducing a fever, these drugs can be used in combination. That's completely safe as long as we remember certain things. Typically, you'll hear that we can alternate these drugs every 3 hours. So that means take a dose of acetaminophen, 3 hours later, the NSAID, such as ibuprofen, 3 hours later, switch back to acetaminophen, and we can continue. But we have to keep in mind the 24-hour limit on acetaminophen. So do not exceed that threshold. The importance of this is this same strategy can be applied in pain management. So if a patient is not responding to either of these type drugs alone, rather than escalating up to an opioid, try alternating the two first. Oftentimes, that's all the patient needs. They can get adequate pain relief, and then we avoid all the complications of opioid therapy. Thank you for joining me again.